Hello, Dallas. It's time to wake up and get wealthy. I'm Terri Arends, the Group Fitness and Wellness Director with the Aaron Family JCC. And we are here today. We have a special guest. His name is Dr. Sherman, and he is a podiatrist. And we are going to talk about how to have a little more pep in your step and take a deep dive into foot care. So, Dr. Sherman, thank you so much for coming on the segment today. I really appreciate
Well, thank you,
you
Terry,
being
for
here.
inviting me. I think it's very sweet of you. Could you do me one favor, however? Since it's just you and I talking,
Okay.
why don't you just call me Allan?
Oh,
Would you
okay.
do that, please?
I would love that.
Thank
Okay,
you.
if you're cool with that, I'm
I am
I'm
very
good with
cool with
that.
that.
All right, great. Well, Alan, I know I see you often here at the J, and I
Yes,
see that you work out.
yes.
So, in addition to working out, tell us a little bit more, just to set the stage here. Tell us a little more, our viewers, about you and a little bit about yourself and
Okay,
your workout activities.
I'll be happy to. I was born uh, 3/4 of a century ago. I'm 75. I was born in Brooklyn, New York. And my parents were both very young. My father was just discharged from the Navy when he met my mom. And my mom was just 19 when they got married and 20 when I was born. They were both chain smokers. And it was very common in the 40s and 50s to chain smoke. And I was born with a significant disease called asthma. And I had a lot of trouble just breathing. I mean, I remember just lying in the crib going, forcing myself to inhale because I thought I was suffocating. And I grew up, really just more sedentary, very nerdish. And my idea of having a good time was probably reading a history book and rather than going out and playing with the guys. And we moved around a bit, and eventually we moved to New Jersey in a place called East Brunswick. And I was fortunate enough. One of the people that lived right near us, within a quarter of a mile, was a guy by the name of Kenny Sampson, who was my age, and he was much more active. But he had a weight set in his basement, and he invited me down to lift weights with him and showed me how to lift. And I thought, this is cool. I could lift weights and I had no asthma. And so I convinced my parents to get me a weight set and I started lifting weights. And, I found out that I was probably 11, 12 years old. By the time I was bar mitzvahed, most of the kids had trouble beating me in arm wrestling. And I was pretty happy about that. And then in 1961, Kennedy became president, and he started the Kennedy Fitness Program. And in it, they started at the beginning of the year, seeing how many sit-ups you could do, push-ups, dips on the parallel bars, and I was at the top of the class for that. And then we had to run a mile, and I was the last one to cross the finish line in my gym class. And I thought, this is not good. And I'm sitting in the locker room, and you talk about good angels. I'm
Mm-hmm.
sitting in the locker room talking to my friend Louis Chellin, and we're just BSing between classes. And one of the coaches comes through, and he remembers me from doing sit-ups and push-ups. He didn't remember me from running the mile. And he said, Allan, I want you to try out for the track team. I thought, that's nobody ever wanted me for any sports. I was always the last one picked.
Oh.
And I thought, if he believes in me, what the heck? And he had me run what was called the 880, which is back, it was yards back then. Now it's 800 meters. And I never finished in a race any higher than last. But when we repeated at the end of the year, the push-ups and the sit-ups, I was still high.
Mm-hmm.
But then when we ran the mile, I could run a full mile, and I finished first in my class of boys. And I felt such a great sense of accomplishment. And my father, who was in sales, went through a
Uh-huh.
very difficult time. And he got in trouble with the IRS and everything. We had to sell our house in East Brunswick. We moved to Clifton, New Jersey. We rented a small house there. But I loved it because then we were also close to my grandparents. So I was within walking distance. But I didn't have any friends in the school. The only kids that I hung out with were neighbors of my grandmother, a guy by the name of Johnny Van Linton, and he went to Popias High School. He was, Christian high school. And these
Mhm.
guys would get together and drink and smoke cigarettes. And I thought that was cool.
Oh my
And I
gosh.
started smoking cigarettes.
Oh no.
And my asthma went from bad to worse. And I wasn't doing any activities. And then I went off to college. And when I came back, that was 1967, I finished my freshman year of college. I came back, and there was, uh, when I went to the airport, my mother was there with my grandfather, my
Mhm.
father's father. And I was wondering, usually my mom and dad picked me up. They usually picked me up and they took me. My father had a good friend who was in the mafia, Vinny. He'd take me to Vinny's restaurant and we would have a very good bite of eat. I mean, good price, good everything, because Vinny was my father's friend. And my father wasn't there. My grandfather was there. And driving home, my mother said to me, your father had his first heart attack. And that time he was just
Oh.
42 years old. And my mom said two things. One, we can't help you financially in school anymore because we're going through a big problem. So you're going to have to work your way through school, which wasn't a problem. Being in New Jersey, I got a job in a factory right away. And then she said, we're going to go visit dad. He was in, he was in a sort of a caring kind of facility, like a rehab. And I went there and I saw my father and my father was always one of those strong-willed, get it done kind of guy, very positive, and he
Mhm.
was a shell of himself.
Hmm.
And it scared the heck out of me. And so every day after work, I found my weight set, I lifted it. I lifted it so aggressively that I pulled a muscle in my arm.
Oh no.
And I had trouble lifting weights. And then when I went back to college, I had a friend of mine who had played high school football. And
Mhm.
I knew he knew something about lifting weights. And I went up to him. His name was Bub. That was his nickname.
Mhm.
And I said, Bub, do you mind showing me how to lift weights properly so I don't get hurt? He said, no problem, but I'm pledging a fraternity. And another guy wants to join us. And now, talking about good angels, this is another good angel. I'd never met this kid before. On the way to the gym, we're passing by the track. The kid said, let's run a mile. Nobody ever ran in 1967. This kid must have run in high school. He ran 4 laps like it was nothing. My friend Bub, there's no such word as jog back then. So if you ran, you actually ran. My friend Bub ran a half a mile. I could not run a quarter mile. Eventually, they stopped coming, and I was up to about a half a mile. I said, I'm going to get to 1 mile. And right around the middle, right around October, the middle of October to the end of October, 1967, I ran 4 laps without stopping. That day, I went back to my dorm. I put out my last cigarette.
Mhm.
I became more of a nerd. I said, I'm never going to drink again, and I'm going to keep this up. And so I've been jogging since that day in 1967 relatively regularly. And I still, to this day, jog.
And to fast forward, I hear you also do marathons,
Yes, I did.
correct?
I've run 50 marathons. And the first one, my other grandfather, my mom's father, he was the only one who was into sports. When he was younger, he loved baseball. He tried to encourage me to play baseball, but I was always afraid of getting hit by the ball. But then also he ran track. And he told me a story. He said that when he was young, he wanted to run the New York City Marathon. Now, it wasn't the same marathon as it is today where it runs through the 5 boroughs. Trying to research it, they just started 26 miles north of the city, ran, and he decided he was going to take a woman's heel, cut off the heel, and tape the shoe to his foot. He said he had such bad blisters, he had to stop at a hospital. Excuse me. He had to stop at the hospital and get attention to get home. Now, he, through his adult life, was a cigar smoker.
Mm.
And he'd chew on the cigar. And in his 80s, he wound up having intestinal cancer, and he came to visit me. And he said, I think I know I have cancer. And I took him to a few doctors that I knew, and they said there's nothing much they can do. Well, he died in my house. And the next morning, I went for a run. And I said, I am going to run the next White Rock Marathon. It was 1978. I'm going to dedicate it to my grandfather, do something that he never did. So in 1978, I ran my first White Rock Marathon.
Oh, wow.
And I've run 49 others since then.
Well, congratulations on that. I mean, just to run under 5 marathons is a lot. Is this a...
No. You know what that's for? I'm glad you pointed that out. Oh. Okay. Now, we're going to talk about injuries later.
Yeah, we are. We got to get into
Okay, I'm sorry. Okay.
Yeah, no. I was going to say that.
Yes, please.
I think I was curious if the marathon running is partially what inspired you to go into foot care and to be a podiatrist. Mm-hmm. Okay. So I think that when I think of a podiatrist, I think of solely, no pun intended.
I like that. I know you use the word solely, but they sometimes say that podiatrists are very calloused people.
Oh, okay.
But let's not get corny.
Yeah. Okay. All right. So I think that basically when I think of podiatrist, I think of totally foot care.
Right.
However, with your backstory here, I'm kind of starting to see that there's more to it than that.
Correct.
So tell me if this is correct, that your foot, your ankle, if you strengthen those areas, you strengthen your legs, that it's all like, it's part of the kinetic chain. Totally. Your foot's totally part of that kinetic chain. So if I strengthen those other areas, then I'm going to have more pep in my step. I don't know if I got that right.
No, I think that's absolutely correct. If you take a look, Terri, here is the bones of the feet, and you can see that there are quite a few of them. Mm-hmm. Now, there are a lot of muscles and tendons that go from the leg into the foot. Mm-hmm. And some of them, like for instance, this particular tendon is called the posterior tibial tendon. It supports the arch.
Okay.
And people with shin splints up on this side of their shin sometimes have a weakness in that area.
So shin splints basically is a carryover type of term that it could mean many things, right?
Correct.
Okay.
But then also,
like there's an underlying cause. I guess.
Cause. Then there's these other muscles and tendons that go right to your toes. So those are the ones you use when you push off. So when you're when you're running and pushing off, you're going to use those muscles and tendons a lot. And that also can affect your shin. On the other side are these muscles and tendons called the peroneals that stabilize the outside arch of your foot. And they can become, people that sprain their ankle, if these muscles are not properly developed, they're prone to ankle sprains. And then in the back, there's a big tendon, one of the most important tendons of our body, called the Achilles tendon. So all of these attach to the foot. It's imperative when a person comes in with an injury for us to diagnose them properly and see what the cause of it is.
Okay, so speaking of when you're talking about diagnosing.
Yeah.
Oops. There we go.
Thank you, Terri.
You're welcome. So if we're talking about, you're looking at, and you're going to determine what is the cause or reason for why they're in your office today. If we could back up one step, and I'm just shopping for a podiatrist, right. Is there any particular guidelines that I should use that our viewers would be interested in knowing?
Well, generally, it depends what you want them for. For instance, one of the things that you mentioned was somebody who has a severe bunion, and we'll talk about that later. There, you want to find an excellent surgeon. Podiatry, some of our specialists specialize in surgery. Others, like a sports-related injury where you play pickleball and you develop muscle strength, there you want to see a sports medicine podiatrist. The other area that I love is what they call geriatric podiatry. Since I'm old, I like to help old people. And, give you an example. One of my friends who was a runner is a dentist, and he referred his 90-year-old dad to my office. He actually came in with, what do they call those things that you're,
A walker?
like a walker. He had a walker. He was pushing it. And he was all hunched over. And when I went to examine his foot, his nails were so long that they were curled down and into his foot, digging into his foot. Some of the nails were so thick they were rubbing in his shoe. He had thick corns on the bottom of his foot. And he had some ulcers on the top of his foot from wearing the wrong shoes laced too tight. So I did some general podiatry care where we trimmed his toenails, got them nice and thin. We trimmed out the parts that were ingrown, trimmed his calluses. He felt so much better. Then I retied his shoe so that excuse me, the laces didn't rub up against the top of his foot right over here. So instead of crossing over, we did what's called a window. And then I made him what they call an orthotic to stabilize, give him more balance when he was walking. We can do that in the office with somebody standing with the right balance now. We can form it to his foot when he's standing. It works so well. So that gentleman right now is, his ulcers completely went away, and I have something in the office called a class 4 laser, physical therapy laser, which sterilized and promoted the healing for the ulcers. We taped his foot, and I also suggested a shoe for him. I'll go over that in a minute. And with the orthotics, he's walking around all the time. Now,
without his walker?
He uses a cane just for balance, and he walks around his house for 1.5 miles every day without a walker, without a cane.
That's awesome.
Now, the shoe I recommended was this particular shoe over here. It's called the Glycerin. It's a Brooks shoe, but it has guide rails. It has a rail on this side and a rail on this side. And what that does is it keeps you centered. So now when he walks, we have him supported from the bottom, but he's centered. He's not leaning in. He's not leaning out. He's guided straight. And it completely changed his life. He's able to exercise. He went from hunched over to his attitude is completely changed. So I love helping older people, keeping them as independent as I can, allowing them to exercise and giving them the proper balance.
Well, I love that story, and I love that this person now, he doesn't need a walker, and he's utilizing just a shoe, and you were able to help him. That's awesome. I was kind of curious, though, you had mentioned earlier about bunions. So let's take a deeper dive when it comes to bunion. Exactly, tell us what is a bunion and how do you get rid of it?
Okay. A bunion is a bump on the side of the called metatarsal bone.
So it's only on the side.
It's like, well, not necessarily. We're going to go to that in a second. What happens? This bone, the first metatarsal, is not stable, and it moves up and moves away. So this rubs inside the shoe, and you get a bump over here. The other kind of bunion you can have is just on the top of the toe joint. Now that's actually our arthritic situation. It's because the joint is not as mobile. It rubs. So every time you push off, it rubs on top. Excuse my coughing.
Of course.
Now, the way to treat most bunions is with surgery. Now, the one thing that you still have to be a little skeptical about, there was a recent advertisement showing a bunion surgery where it showed a woman and showed what a bunion was, and they showed a procedure which is like what they call a minimal. So instead of slicing her open, minimal incisional, but in other words, through smaller cuts, they say faster recovery. But it's still a painful procedure, and the bone has to heal. So it's, you have to be careful with bunion surgery, and you need to go to a doctor who specializes in it. And even then, they found that in that particular procedure, there's a 10% chance of it not working properly, which is
Oh.
a lot. To go through all that and not have it work right. And one of the problems, they said there are two problems. One, the bone, you have to cut the bone and realign it and put screws and pins in. The problem with that, mm, uh, okay, the problem with uh, the procedures, there are two things that they found. One, people that are overweight, they put a
Hmm.
lot of pressure on their feet, and sometimes the bones don't heal as well. And people that don't have strong bones, or
Hmm.
what they call osteopenia, which is
Hmm.
the calcification in the bone isn't as strong, or the a little worse case, osteoporosis,
Hmm.
and those people do not heal as well.
Oh, so like if somebody does have a bun, can it be taken care of in an office, or it must be done
Well,
outside of the
all of
office
those
visit?
procedures are done in the hospital.
Okay.
There is a procedure where we can do it in the office.
Okay.
It's called a minimal incisional procedure,
Okay.
where we're just trying to get rid of pain because of a bump. So what
I
we can
see.
do is to
Okay.
numb the area where the bunion is with a
Hmm.
little local. Then instead of making an incision, we make a little puncture. We insert almost like a little dental file, and it just files the bunion,
Hmm.
reduce it to a paste, and sucks it right out of the foot, and the patients walk on out.
Got it.
But it's
Yeah.
not the big procedure you see
Mhm.
on TV.
Yeah. Okay. That makes sense because I'd known that I thought you could do something like as
Totally.
just a minimal type of procedure. Another thing that I think has really changed is orthotics.
Yes.
Like I always kind of visualized or understood that if I'm going to need orthotics, I'm going to need to go to a podiatrist. But now I'll walk into the local neighborhood drugstore and they're selling them. So tell
You're
me a little bit more
you're
about
exactly
this.
right. Now, generally, there are lots of companies that make orthotics.
Hmm.
They have Dr. Scholl's. They have Vionics makes an orthotic. Uh, a Superfeet makes an orthotic. Uh, Power Step makes an orthotic. Curex makes an orthotic. Vasilis, and those are just four different types. Now, the problem is when you go and you pick one off from a drugstore. Here's an
Hmm.
example. Here is one that we could look at. You can see it's very, very, very flat. It doesn't have much of an arch, doesn't have much of a heel cup. And it's made to accommodate, if when people have a bunion, the big toe joint. Now, that's an example of one. Here's an example of another one where it's built up. They put on, this is a power step. They have a more firm arch support, and they have what they call a heel post. But the problem is sometimes well, you'll see it can overcorrect. So on this one, you step down on it, you're actually lean out a little bit, which could cause a problem. So if I take off my sock and stand, you can see that it leans me to the outside.
Oh, yeah.
Now, so this is a power step. This over here is another one where it doesn't have the heel part, but has the arch part and is a little bit more flexible, where the other one's more rigid. So there are all different kinds of over-the-counter arch supports.
Mm-hmm.
Here's another one.
So these would be more just generic, but then if I need something more custom built, then I'm going to come to you.
These
right?
are all generic. Now let's talk about it. Let's say that you have an issue and you want to try an over-the-counter one, which is not a problem. The statistics show that about 25% of the time you could go over there and pick one out. It'll work. But there's about a 20% chance that it'll actually make the condition worse.
Oh my.
Because it can cause you to put too much pressure on an area or take it away, or that there's about a 30% chance that it not only will not make the condition worse, but it can cause a different condition. Now, this is an orthotic that I had that was made for me, and you can see it's made with my arch type and a post on the heel. Now, when I stand on this, it's comfortable and supportive, but doesn't lean me in, it doesn't lean me out. It keeps me straight.
Mm-hmm.
So making an in-house orthotic or making one, there's an advantage that it's made just for your foot. It's not made for anybody else's. Usually, the way that they make these orthotics is they have what they call a last. A last is what they press it for. It looks like a foot. And they just press them out and put them out, where it's not made with your foot in mind, but it's worth a try. Like I said, a 25% chance that will cure your problem.
And how often how often would one replace, whether they buy it in the drugstore, whether they have a custom made one? How often do those last?
Okay, usually it depends on the person. You know, what are you using it for?
Okay.
You know, a person who's a runner, it's not going to last as long as somebody who's going to use it to go walk around the neighborhood or walk the dog. It depends on how heavy you are. And it depends on the mechanics. Where are you trying to build it up? So how long do they last? Everybody's different. I've had patients in them. I had a patient come in just the other day that had an orthotic for 5 years. He said, you know, I have no pain. He does that walk in northern Spain. You know what I'm talking about? They have that walk that goes.
No, I'm not sure.
You know, they go to these not historic, Christian places, and they walk actually from all the way from Spain to Portugal, and there are places along the way that they stop. It's like a pilgrimage. And he's been doing it for years. And he said, you know what? I've been wearing my orthotic. I have no problem. He brought it in. He said, you know, I'm ready for a new one. And he's already had it for 10 years.
So it really does vary.
It can last for a long time. Right. And this guy carries a backpack and walks.
Wow. Wow. Well, that lasts a long time for him with all the miles he's been putting on.
Totally.
He must make good orthotics.
Well, you know, the goal is to make things that work well and last long.
Yeah.
But, you know, again, you know, some people take better care of them, other people don't. And yeah.
Well, I see you have a ton of shoes here on display. And so I was also, the same thing goes hand in hand with shoes. Is there any way?
No, we don't say that. We don't say that.
No?
We don't say hand in hand. We say foot and toe.
Oh, yes, of course. Now, well, with these shoes,
yes, let's talk.
You know, let's talk shoes for
okay, now there are 3 different kinds of arches, okay, or 3 different kinds of foot types. We have ones that fall apart and drop on the floor. We have ones that are, let's take our eyes. Our eyes are, when we look at things, it could be 20/20 vision, where our eyes can see things at different. It could be nearsighted, where we see things close but not far away, or farsighted. In feet, we could either have a normal foot, which is this is the 20/20 foot, right? We could have a high arch, or we could have a low arch where the arch flattens and goes down. So, so there are people where the arch completely collapses. They need something with a little bit more support below the arch. And for those, we can go with what we call a straight-lasted shoe. Now, what does that straight last mean? If you look at the bottom, you see this, it's filled in.
Oh,
Do you see this?
uh-huh.
This is
The
where the
side, you're
arch
talking about the
is.
side?
The arch,
Mm-hmm.
yes. So therefore, it stops it from going in. Then we have shoes. Now that's for a flat-footed person or a person that rolls in. Then we have shoes for normal feet, and this is for a normal foot. It's called semi-curve. This is called a straight last because it's filled in below the arch. This is all left foot. I'm sorry, this is the left that's filled in. This one curves a little bit. This is a semi-curve. And that's for a normal arch because they don't need that extra part. And then there are people with the high arch. They tilt out. They do what we call supinate. And for those, we go for a curved lasted shoe. So this is an example of a shoe with more of a curve, but you can see below the little toe, they have a little pod. So what it does, it keeps the foot from rolling out too much. So this is a curve lasted. Here's another example of a curve lasted shoe. You see it curves in a lot more. Mm-hmm. And they don't need arch support. They're mainly on the outside part of their foot. So for a high arch, we go with one with a little curve with maybe a little outside support. For a normal arch, we go for what they call a semi-curve, where it curves in a little bit. Okay. And for a flat foot, or a person who pronates in a lot, we go with what they call a straight last. Now, very important that when a person comes in to get shoes, one, they check them barefoot, excuse me, and they check them standing. Because that way you can see what the arch does. Mm-hmm. Okay? And you want to check both feet because it's not unusual that one foot's going to be a little different than the other foot. You know, just like one eye is a little different than the other eye. And this is kind of fun. Anyway, and so there's different lasts you want to find for a different shoe. Now, shoes have also changed a lot over the time.
Can I stop you there? So all that information, if I'm going to shop for a shoe, how am I going to know that this one's good for a flat foot and this one isn't? And I mean, I think when I'm looking like online or reading a little about the shoe, is that information on there?
Usually, if you go to a good athletic shoe store,
okay,
they will know.
Okay.
And it's important that you get a person who understands the different things because, you know, a couple of things when you check shoes, you want to make sure that the shoe fits. Mm-hmm. So you want to make sure you measure both feet. And again, you measure them with your standing. And then you want to look at their arch type. And that helps you to pick that. And then the other thing that I recommend, if you go to an athletic shoe store, bring in an old pair of athletic shoes. Why? An old pair of athletic shoes tells the person that's helping you what you're doing mechanically. They can look at the outer sole. That's the part over the hard rubber on the bottom. It usually tells you where you strike the ground. Most of the people strike it on the outside part of the heel. Then it also tells you the vertical forces. Now, the other thing you can do is you can take the midsole, which is made of a more rubbery, compressive material to absorb shock. You can actually push up and you can feel where the shoe is giving away, it tells you the vertical forces that are going through. And then lastly, if they pull out the liner, you can actually see the heel, where the toes are, the forefoot, and you want to make sure that where it's compressed too much, that's usually where they're putting too much pressure. So you want to go ahead and go with a shoe that has the correct amount of protection.
So how would I know though, when I need to go get, is there a way to tell if you need new shoes or you need new orthotics? Like,
Yeah,
how do I judge that?
usually, from a shoe, you can see the shoe's worn a lot. The outer sole will be worn too much. The midsole will become compressed. And one of the shoes that's out there is very common is the Hokas. The Hokas have a lot of cushion,
Yes.
but if you look at a Hoka shoe, it looks like it weighs a ton. You think, dang, that shoe I won't be able to lift it up off the ground. But it's as light as a feather. And the reason is they put a lot of air in the midsole material. So the problem with air in the midsole is that as you wear it, it compresses. So if the shoe starts to compress and lean you out too much, you start to develop symptoms on the outside part of your leg. If it compresses too much on the arch side, you'll roll in and you'll get too much pressure either on the arch or in the muscles on the inside part of the leg.
Oh, that's really interesting to know, and that's really good. I know several people that are using that shoe, and I
Right.
always just wondered, just from looking at it, that like you just said, it looks like it's so heavy. Why would you want that on your foot?
It's as light as a feather.
Wow.
But the problem is that it compresses quickly.
Mm-hmm.
An interesting conversation I had talking about shoes is, shoes change all the time.
Mm-hmm.
20 years ago, the common shoe we would see when I was a medical advisor at Luke's Locker was a shoe called the Vibram, which is the 5-finger shoes. Have you seen those?
Yes.
Now, basically, back then, everybody wanted to wear those. And obviously, they found out that it did not support the foot properly, and a lot of people wound up getting injured in it. But I was talking upstairs to one of our wonderful trainers, Emily. Emily loves balance. She loves to be a dancer. She floats when she's working out. And I watched her, and she was wearing a pair of athletic shoes. And I said, well, you like to work on balance and work on your toes and stuff like that. Why don't you try the Vibrant shoe, the 5-finger shoe? She says, I have one at home. And she didn't. And she said, you know what? Maybe I'll wear the ballerina. She used to be a ballerina. And I said, I think, she agreed with me that the 5 fingers allows you to use the smaller muscles, the intrinsic muscles. So when you're developing them or stretching them, you can work on them more individually with the Vibrams. And now shoes have even changed where more for forefoot striking. Remember the story about my grandfather and the heel, and he taped the heel to his foot. Now they're making shoes with either a carbon plate or a plastic plate in the forefoot to have you propel forward faster. And they've actually have a little bit more of a rocker bottom below the midfoot to the forefoot, so it pushes you forward. So shoes are changing all the time.
Yes, and that's good that shoes continue to change.
Totally.
Like
But the
ever so
problem
changing.
is that sometimes you fall in love with a shoe.
Mm-hmm.
Say, this is the best shoe.
And
I
then you
grab
can't get it.
pickleball, and you go to get it a year later,
Gone.
and it's gone. So you got to be
Yeah,
careful.
yeah. I guess you have to stock up.
You have to stock up.
Well, Allan,
Yes.
thank you so much. I just wondered if you had anything else, like final take-home points for our viewers, anything else that you'd like to share. I thought that this was really interesting, especially with all the different options out there with the shoes and the orthotics. And those are common questions, like even as the wellness director that I get. So I was just wondering if you had any, last minute pieces of information
Okay, I have
to
a
share.
few things I would suggest. One, I see a lot of new members coming to the YJ all the time. And they are, when I watch them up in the weight room, they're not using the weights correctly and they're being too aggressive. And they're there for a week or two. I don't see them afterwards because I think they're getting hurt. One suggestion I have is that people, new members that want to use the weight room, should hook up at least for a few weeks with one of the trainers. They are wonderful up there, teaching them how to lift the weights properly. I think one of the things that I personally have learned with lifting weights is I don't use a lot of weight. I use a lot of times I'll get on the weight, a woman will be ahead of me, and I'll have to put less weight on me because I'm not using as much weight. But I try to go through a full range of motion, and I don't jerk it. I go slowly all the way up, all the way down, and it helps to strengthen my muscles and tendons of the joint. I've been one of the questions you didn't ask me is you said, I've been running, and I joined Cooper's right around 1980, and Cooper wanted us to log our miles. So we would log our miles, and then once a year we had to do a stress test. And so from about 1980, again, I started running in 1967, until presently, I have kept a log of the amount of miles that I run in the morning. And you want to read that amount?
Oh my
How many
gosh, we
miles is
are
it?
talking 103,669.
So that's the equivalent
Wow.
of running the circumference of the earth is just under 25,000 miles. It's the equivalent of running around the circumference of the earth 4 times and having enough miles left over to run east and west across the United States. Now, again, people ask me, do your knees hurt? Do your hips hurt? No, I wear orthotics. I wear proper shoes. I do strengthening exercises. And very important, I was here one day when one of the other ladies was here talking about the importance of stretching. And I believe in flexibility is also as important. The other thing on this number over here, I run in my neighborhood now. And one of my neighbors said, Allan, I see you running almost every morning. How many days in a row have you run? So I had a log. So I went back. It was about 240 days. I figured, I'm feeling good. I'll go, foolish number to stop at. I'll go another 60 days. I ran 300. Foolish number to stop at. 65 more days. It's a mile. Anyway, to make a long story short, this is the number of days that I've run in a row.
Which one? This one?
No, that
this
one
one
on
at the
top.
top? Yeah. Oh, okay, sorry. 4,975 days in a row.
Right. Plus.
That's pretty incredible.
Right. And the least I've ever run is 4. Now, I'm not, like I mentioned in the beginning, I'm not a great athlete, but my goal is to be a good example for my patients. When I was growing up, I don't know about your mom, but back in my generation, if you asked your mom about something, they had a big saying. They used to say, do as I say, not
as I do.
Not as I do. And I remember my mom telling me that, and I thought, that's ridiculous. If you want me to behave a certain way, show me. Well, I believe in trying to be a good model for my patients. What does that mean? I try to do the right things. I don't tell them, you know what, put a boot on, stop running. I tell them, okay, let's find out what your problem is. Let's figure it out. Let's work on strengthening it, stretching it. Let's work on physical therapy, maybe make you a device, put you in the proper shoes so that you can continue to exercise like me. Then also the other things I try to do is I try to eat better. I try, I stay away from alcohol. I don't smoke.
Good hydration.
Good hydration. Got to drink lots of water, especially in the heat of the summer. And I stretch and I do the strengthening exercises. And I think that those things have allowed me to run over 103,000 miles. My knees don't hurt. They're the same knees I was born with. My hips don't hurt. I've never had any surgeries on myself personally. And my goal is to keep my patients active, keep them going, keep them on trail, but be an example for them so they can feel comfortable knowing, hey, look, you hurt over here, stop doing it. No, let's figure out why. Let's figure out a path forward, not backwards.
I love that. I am so on your page. I mean, just when people come in here, it's just all about Doesn't matter what you do, it's how you do it and to keep moving.
And
Just keep them moving.
and the one other thing that I have to say about the J that I really like is two things. One, it's very safe. You know, I was a member of LA Fitness for years, and another guy followed me over here from LA Fitness, and he said that they broke into the lockers over there,
Oh my
24
goodness.
lockers. Here, your stuff is safe. The other thing I love about it is it's very inclusive. Is that the right word? We have all different kinds of people over here, and I
Yes.
love it that everybody feels safe and wanted at the J. And it's a beautiful place. Everybody is welcome, and we want you to be here and be a part of our team.
Well, thank you so much, Doc. I really appreciate you being on the segment today. And for you guys at home, remember when you wake up, get wealthy, and we'll see you next time. I'm Terri Arends. Bye-bye.